Okay, so it's 10 o'clock. We'll make a start. So thank you for attending our webinar on drug and alcohol testing updates this morning. It's great to have you all online with us today. I'm Liam Feasey. I'm the Client Services Manager and the Deputy Quality Manager at Lextox, and I'm also one of the experts at Lextox, and I'll be delivering today's webinar for you. Before we start, just a bit of housekeeping. All attendees have been set to mute. This is to reduce background noise and to ensure everyone can hear us clearly. This is a live broadcast, and due to the number of delegates attending today, unfortunately, we won't be taking questions during the actual webinar itself. However, if you do have any questions, please feel free to get in touch with us via experts@lextox.co.uk, and we can respond to you accordingly. Today's webinar should last approximately 30 minutes. It will be recorded and we'll share the link with you post-event. We are in the hands of the power of the internet, so in the event of any connection failures, I apologize in advance. If that is the case, we will record the event again and send a link through to you afterwards. Okay, so let's make a start. So today, I'm going to be giving you an update on the pandemic and the effect the pandemic has had on drug and alcohol misuse. And then I'll follow that up with how Lextox is responding to the pandemic. I'll then go through some of the latest news of some of the services that we're offering, such as PEth testing, hair alcohol testing, the use of hand sanitizers, and if that can impact on the alcohol testing that we provide, prescription drugs, and CBD oil. I'll then conclude with a summary, so that'll be some finishing points and highlights, and then how to get in touch with us after the event if you'd like to. Okay, so I'd like to start by talking about the impact COVID-19 has had on alcohol use during lockdown. So according to a number of reports from trusted sources, an increase in alcohol sales has been highlighted in the media during lockdown, with numerous reports of people increasing the amount of alcohol they consume as a result of COVID-19. So increased consumption has been attributed as a coping mechanism and as a result of boredom. So Alcohol Change have reported that 3.5 million adults are living in households where alcohol is leading to greater tension or conflict during lockdown. The Global C19 study has said that large increases in frequent drinking have been seen among those who have children under the age of 18 in the home compared with those who don't. And a YouGov national poll on addiction behaviours in lockdown has said that a quarter of adults not in recovery from addiction prior to lockdown have increased their alcohol consumption since lockdown. And of those who have increased their drinking, about 15% have experienced related problems. So moving our attention onto drug misuse, lockdown has had an adverse impact on those with existing substance misuse issues, those in recovery trying to access treatment, recreational users, and those using prescription drugs who are exceeding the recommended dose. An ITV report has stated that drug offences in England and Wales rose by 27% during lockdown, despite total recorded crime dropping by a quarter. Lockdown has led to a change in the type of illicit drugs that are being misused, and according to the BBC, experts are warning of a post-lockdown binge. Research by the Global Drug Survey has found that cannabis use was up. They found that 43.8% of UK respondents have increased their consumption of cannabis products since COVID-19 restrictions were imposed. While the use of prevalent drugs such as cocaine remains high, the use of stimulants or party drugs such as MDMA have declined. Throughout lockdown, family courts have remained open and are operating virtually. AdFam have released a report called Families in Lockdown, which includes the following statistics. So 88% of respondents said the lockdown is negatively impacting on their family members' alcohol, drug, or gambling problem. AdFam report found that 36% of survey respondents were worried about their parents' addiction problem. And most of the 5 million people affected by a family member's alcohol or drug use are trapped in a deepening crisis, and there are few people in services receiving support. So since our services restarted in April, Lextox has been working hard to meet client and family court requirements while keeping staff, clients, and our donors safe. In this time, the Lextox team has sent over 8,000 drug, alcohol, and DNA quotations. We have booked over 4,300 sample collections, attended over 3,500 sample collection appointments, and sent over 2,600 expert reports. We are continuing to arrange and attend sample collection appointments within our usual target of 48 hours notice, and results for hair samples are currently being issued within an average of 5 working days. So as lockdown restrictions ease and more of the UK returns to work, we wanted to share details of what we have implemented to continue to provide the level of service our clients have come to expect safely. So our sample collection team are fully equipped with the relevant personal protective equipment. When booking sample collection appointments, we are asking our clients a series of questions on the health of donors to ensure everyone's safety and to prevent the further spread of the virus. And steps have been taken to reduce the number of staff in our offices and laboratories, and we have marked out designated working spaces to meet the 2-meter social distancing criteria. So moving on to our online services, in response to social distancing measures, our reporting scientists are able to attend court virtually. And this is either via Zoom, Skype for Business, Teams, or the court's own software facility. Our expert witnesses are able to explain the testing results, including the sample analysis and chain of custody, and we're able to actually provide an opinion and an interpretation of those analysis results. Our CPD seminars can also be delivered online, and these provide an outline of the evidence drug and alcohol testing can provide when assessing parental substance use in family law and childcare casework. Should you feel that you yourself or your team would benefit from an online CPD, please do get in touch with us and we can organise that accordingly. Okay, so moving on to some of the latest updates and news regarding some of our services. As many of you will be aware, in response to the latest test methods and requests from family courts and clients, Lextox now offers Phosphatidylethanol or PEth testing for blood alcohol analysis. I'm conscious that I haven't presented on this subject before, so I wanted to take the opportunity today to talk to you about this test and give you more information around what the test can actually show. So Lextox first introduced phosphatidylethanol testing in September 2019. And since then, we've completed over 690 tests. So PEth testing is a reliable method to help create a picture of alcohol consumption using a blood sample. A PEth blood test measures the level of phosphatidylethanol, which is a direct alcohol biomarker found in blood following alcohol consumption. So the more a person drinks alcohol, the more PEth will be formed in the blood. So PEth blood testing is useful in detecting prolonged or heavy drinking when tested for regularly. And typically the detection period for PEth is 4 weeks. Because PEth is only formed in the presence of ethanol, it is a reliable test method for determining alcohol use. This also means that it has a high sensitivity due to its direct relation to alcohol consumption. Unlike indirect alcohol markers that can be found in blood, PEth is also useful because it is not affected by medications and other health conditions. Experiments show that PEth can be detected in blood shortly after consumption and for up to 12 days after a single drinking episode. As alcohol accumulates in blood with frequent alcohol consumption, it can be used to determine chronic excessive alcohol use. Now, just to be clear, a single drinking episode wouldn't be expected to give a result in the range for chronic excessive alcohol use. So an individual would need to be consuming alcohol on a regular and frequent basis to get levels within the chronic excessive alcohol use range. At Lextox, we offer PEth testing and recommend a combined analysis of this alongside other alcohol biomarkers to help provide clients with a better picture of alcohol use over time. Okay, so moving on to hair alcohol testing using ETG and ETPA, which is ethyl glucuronide and ethyl palmitate. ETG is produced in the liver when alcohol is ingested, whereas ETPA is detected or formed in the body in the presence of alcohol. Now, I understand that a number of laboratories may only suggest that one of these markers, i.e. ETG, can actually be used or is required. But today I'd like to reconfirm why Lextox continues to recommend both ETG and ETPA testing in conjunction as standard. So ETPA and ETG are different markers that, when used together, can provide a greater degree of confidence when assessing an individual's chronic excessive alcohol consumption. Now, as I said, ETG is produced in the liver. ETPA is produced by the body in the presence of alcohol. As such, they're produced by the body independently, and we undertake independent tests. In addition, the use of chemical hair treatments such as bleach and hair dye can actually reduce the levels of ETG and ETPA in the hair. ETG is more susceptible to the effect of these chemical hair treatments such as hair dye and bleach. So in certain circumstances, it's beneficial and ETPA can provide evidence in isolation to help in the assessment of chronic excessive alcohol consumption. Lextox has taken guidance from the Society of Hair Testing consensus for the use of alcohol markers in hair for assessment of chronic excessive alcohol consumption, and provides ETPA and ETG analysis as a combined test as standard for the mutual confirmation of results. So on the subject of alcohol testing, we have recently received many questions on whether the use of hand sanitizers can affect the hair alcohol test. So in response to the COVID-19 pandemic, many of our normal hygiene practices have changed dramatically, and the use of hand sanitizers, even ones that contain alcohol, will not give rise to a positive result. So as discussed on the previous slide, we test for two alcohol markers in hair, which is ETG and ETPA. And as I said, ETG is formed in the liver, so this is a very specific marker for alcohol use, whereas ETPA can be elevated through the use of products containing alcohol. So as long as the hand sanitizer is used as per the manufacturer's guidelines, i.e. on the hands, and not directly applied to the hair or consumed, then the use of the hand sanitizer, even if it was used excessively, will not give a positive hair alcohol analysis result. In addition, the use of hand sanitizers will not affect the blood alcohol testing. And this is because the hand sanitizer isn't being consumed. So even if it's used excessively on the hands, similar to the hair test, it will not provide or affect the blood alcohol analysis. Okay. So if we move our attention towards drug misuse and how this has changed during lockdown, the misuse of illegal drugs are not the only concern. Prescription drug misuse has the potential to further increase as a result of the current COVID-19 pandemic, as illicit drugs become harder to obtain and mental health conditions rise as a result of the pandemic. Painkillers, antidepressants, sedatives, and anti-epileptic drugs used to relieve pain are all highly addictive and easy to access. And I understand that the dependency can lead to impaired judgment, drowsiness, and serious withdrawal symptoms. So the Times have reported that the COVID-19 is wreaking havoc on the nation's mental health, said Dr. Martin Marshall, who is chairman of the Royal College of General Practitioners. And the AdFam Families in Lockdown report has stated that almost 2/3, so that's 61% of AdFam survey respondents, said that the lockdown is negatively impacting the mental health of a family member. Now, Lextox tests for an extensive range of prescription drugs, including antidepressants, and you can contact us to understand which drugs that we can actually detect in hair. Okay. So moving on to cannabis. So last on the agenda for today is CBD oil. And we've received a growing number of queries from clients on the use of CBD oil. So I thought I'd take the opportunity today to talk around this and provide more information around the use of CBD oil. So cannabis remains the most commonly used illicit drug in the UK. Now, the active compound of cannabis is a substance called delta-9 THC. So this is the compound that individuals get the effect from when using cannabis itself. Now, CBD is a compound found within the cannabis plant itself and is very different to the delta-9 THC. So CBD oil contains the compound CBD, which is cannabidiol, and this has gained popularity in the US and the UK in recent years. Now, the CBD oil, i.e. the CBD, isn't psychoactive, and it's therefore available to purchase over the counter, and as a result, it's heavily regulated in the UK. Now, legally, legitimately bought CBD oil must contain 0.2% or less of the psychoactive compound delta-9 THC, if any at all. So therefore, individuals who use legally purchased CBD oil may have concerns about whether it caused them to have a positive hair test for cannabis, i.e. delta-9 THC. So commercially available CBD oil, as I said, contains little, if any, delta-9 THC, and it contains mostly cannabidiol, which is CBD. Therefore, the use of CBD oil should not give rise to positive delta-9 THC results or cannabis metabolites in hair testing results. Okay. Now, when we undertake the hair analysis for cannabis, we're actually looking for the psychoactive compound, which is delta-9 THC. And we also look for 2 of the specific metabolites of delta-9 THC to help confirm cannabis use. So we do not actually test for CBD itself, which is cannabidiol, or another constituent of the cannabis plant, which is cannabinol. Okay, and then just to provide a summary of what we've talked about today. Drug and alcohol misuse has changed during the last 3 months. While many courts, solicitors and local authorities are still operating online, requests for drug and alcohol testing for family law cases is rapidly increasing. Here at Lextox, we're still providing services as usual, but in a very safe and measured way. And we've outlined the precautions that we're taking to ensure that we're still providing those services safely. So collectors using PPE, asking donors to provide information around their health prior to a sample collection. Requests for PEth blood alcohol testing are increasing, along with tests for prescription drugs. And following guidance from the SOHT consensus, Lextox is providing ETG and ETPA analysis as a combined test as standard. And we've talked about CBD oil and how the use of this should not give rise to a positive delta-9 THC cannabis result in hair. Okay, so that brings us to the end of today's session. I would like to thank you all for joining us in this morning's webinar. If you do have any questions, please feel free to contact us using the details on the screen. Likewise, if you have any topics that you'd like us to cover in future webinars, please do email us at experts@lextox.co.uk. Also, if you would like a more specific CPD seminar for yourself or your teams, please do get in touch with us and we'll be happy to organise that for you. Please email us at experts@lextox.co.uk. So once again, thank you for joining us for today's session. It's been a pleasure to speak to you all today. Take care and hopefully see you on one of our future webinars in the near future. Many thanks. Goodbye.